Okay, get ready. Because we're going deep today
Oh, yeah.
into a topic that's fascinating but also a little bit tricky.
Definitely.
Jinn, mental health, and how these two things come together within Islamic healthcare systems.
It's a conversation we need to have.
Absolutely. And, there's so many misunderstandings surrounding it.
Right. Like, where do you even begin?
Well, luckily, you brought some awesome research.
You tried.
You did, especially this article that analyzes all those studies and case reports about Jinn and mental health, right?
That's the one.
So the mission for this deep dive is to untangle that knot, to understand how the belief in Jinn affects how we diagnose, treat, and support Muslims who are dealing with mental health challenges.
I like that, untangling the knot.
Right.
It's a good way to put it, because sometimes it feels like there are all these different perspectives and they're just kind of
All tangled up.
exactly.
Especially when you consider the differences between what Western medicine says and what we understand from a traditional Islamic perspective.
It's like we're trying to fit two different puzzles together.
And they don't always have the same pieces.
Not even close.
But it's interesting. The research you brought shows that there's actually a growing body of scientific work that acknowledges how Jinn beliefs can impact mental health experiences.
Yeah, that's what really surprised me, too.
It's not just anecdotal anymore.
It's becoming more mainstream, which I think is important.
I agree.
Because it means we're finally starting to take these beliefs seriously and explore them in a rigorous way.
So let's back up for a second, make sure everyone's on the same page.
Yeah.
I think most of our listeners have heard of Jinn.
Right.
But could you give us like a quick Jinn 101, just the basics?
Okay, so jinn, according to the Quran, are beings created from smokeless fire.
Smokeless fire. That's always so intriguing to me.
Right. It's like this powerful image.
Yeah.
And they have powers that humans don't, and they live among us, but we can't see them.
It's wild to think about, like, there's this whole other world existing right alongside ours.
I know, right?
And there are different types of Jinn, too.
Oh, absolutely. You've got Muslim jinn, Christian jinn, even Jewish jinn.
Whoa, I didn't know about the Christian and Jewish Jinn.
Yeah, it's like they mirror our own diversity.
That makes sense.
And they're not all good either. Some are helpful, but some are mischievous, and some are just plain bad.
So how does this belief in Jinn connect to illness, especially mental illness?
Well, traditionally, it's believed that jinn can cause all sorts of problems, both physically and mentally.
Yeah, I remember growing up, there were always stories about Jinn causing people to get sick.
Right. And sometimes it's thought to happen through possession.
Possession.
Yeah, where a jinn actually enters a person's body and starts messing with their thoughts and actions.
That's a scary thought.
It is, and you can imagine how confusing that would be for someone who's already struggling with their mental health.
Absolutely.
Imagine you're feeling anxious or depressed, and you believe it's because a jinn is inside you, tormenting you.
And then you go to a doctor who's only looking at it from a purely medical perspective.
Exactly. They might say, oh, you have anxiety, here's some medication, without even considering the possibility of jinn.
And that's where the clash happens.
It's a head-on collision between two totally different ways of understanding the world.
And it can have real consequences for people's health and well-being.
Absolutely.
The research actually quotes one source saying, biomedical practitioners may feel uneasy addressing religious and other metaphysical issues, and may tend to label claims of contact with invisible living entities as hallucinatory or delusional in nature.
Which is so dismissive, right?
It's like they're saying your beliefs aren't real, your experiences aren't valid.
It invalidates the person completely.
And that can lead to misdiagnosis, delayed treatment, and a whole lot of distrust to the healthcare system.
Yeah, it's like they're saying, we don't understand you and we don't really want to try.
So what do we do about it?
Well, first, we need to understand the scope of the issue. This study we're talking about, it reviewed over 100 scientific texts and almost 50 case studies that mention jinn as a possible cause of mental disorders.
Wow, that's a lot.
It is. And the diagnoses they looked at included things like schizophrenia, mood disorders, epilepsy, even OCD.
So it's not just some fringe belief that a few people hold.
Nope, it's pretty widespread, and it's affecting how people experience mental health in a variety of ways.
Okay, so we know it's a real issue, but what are we actually seeing in these cases? Like, are there any common symptoms or experiences that people are reporting?
Well, one thing that popped up a lot, especially among those diagnosed with schizophrenia, was multimodal hallucinations.
Multimodal hallucinations.
Yeah, it means they're experiencing things that others don't, and it's happening across multiple senses. They're seeing things, hearing things, smelling things that aren't really there.
Whoa, that's intense.
It is.
So we're not just talking about abstract beliefs here, right?
Right. These are real, tangible experiences that can be incredibly distressing.
And that's where we have to start looking for solutions.
Absolutely.
Solutions that bridge the gap between these two worlds, the world of Western medicine and the world of Jinn beliefs.
We need to find a way to bring them together in a way that makes sense for the individual and helps them heal.
And that sounds like a perfect segue to the next part of our deep dive.
Let's do it.
We'll explore the different treatment approaches that are being used, both traditional Islamic practices and modern biomedical interventions, and how they can work together to provide comprehensive care that respects both faith and science.
I can't wait to get into it.
Me neither. See you next time.
See you next. Welcome back. Let's pick up where we left off.
Yeah, I'm really intrigued by this idea of finding ways to combine Islamic and biomedical practices in treating mental health.
It's a really fascinating area, and honestly, it's only recently that we've started seeing more attention paid to it.
Right, it's like we're finally acknowledging that for many Muslims, faith isn't just something separate, you know?
It's not just a Sunday thing. It's woven into every aspect of their lives.
Their worldview, how they understand health and healing.
Absolutely.
And that quote from the research about building those working alliances between mental health professionals and religious counselors, it just makes so much sense.
Yeah, it's like a light bulb moment, right?
Why haven't we been doing this all along?
I know, but I think there are a few reasons why it hasn't been more common.
What kind of reasons?
Well, for one, there's a lack of understanding on both sides.
Okay, so how do we fix that?
Well, we need more education.
Right.
Mental health professionals need to be trained in Islamic beliefs and practices related to health and healing.
So they can understand where their patients are coming from.
Exactly. It's about empathy, seeing the world through their patient's eyes.
Because if a doctor doesn't understand the role of Jinn in a patient's life.
Then they're missing a huge piece of the puzzle.
And on the flip side.
You mean within the Muslim community?
Yeah, exactly.
There can be hesitancy, even distrust towards Western medicine.
Some people might see it as conflicting with their faith.
It's like they're afraid of losing their spiritual identity.
It's a two-way street for sure.
We need mental health professionals who are willing to learn, and we need patients who are open to different approaches.
Okay, but how do we actually bridge this gap? Where do we even start?
I think open dialogue is key.
Right, like actually talking to each other.
Yeah, creating spaces where we can share our knowledge and perspectives without judgment.
And maybe even involve religious counselors or imams in the treatment process.
Absolutely. Imagine having an imam who understands the patient's spiritual concerns working alongside a therapist.
That's what I'm talking about, a holistic approach that takes care of the whole person.
Mind, body, and spirit.
Because healing can happen on multiple levels, right?
Exactly. And this integration can take so many forms.
Like what? Give me an example.
Well, one way is to incorporate ruqyah alongside medication and therapy.
So if someone believes they're afflicted by Jinn,
the recitation of Quranic verses can bring them comfort and spiritual protection.
it's like adding another layer of support.
Exactly.
But we have to be careful, right?
Of course.
We can't just accept all traditional practices without question.
Absolutely not.
Some might not be evidence-based, and some could even be harmful.
That's why communication is so important.
Right, between the patient, the mental health professional, and the religious counselor.
They need to work together as a team, sharing their knowledge and making sure the treatment plan is both culturally sensitive and medically sound.
It's a delicate balance.
It is, but the potential benefits are huge. Better communication, increased trust, and ultimately better outcomes for the patient.
Okay, so we've talked about the importance of understanding and integrating different perspectives. But there's another piece to this puzzle, right?
You mean the impact of Jinn beliefs themselves?
Yeah, like how believing in Jinn could actually affect the course of someone's mental illness.
It's a tricky topic, but an important one.
We've talked about how dismissing these beliefs can lead to misdiagnosis and delayed treatment.
Right, but what if the belief itself, how someone interprets it, could actually make their symptoms worse?
Whoa, I hadn't thought about that.
Imagine someone who believes they're constantly being attacked by malevolent Jinn.
They would live in a constant state of fear.
Exactly. That kind of belief can fuel anxiety, paranoia, even delusions.
It's like they're trapped in their own personal horror movie.
And that's where a nuanced understanding of Jinn beliefs becomes crucial.
We can't just say, oh, believing in Jinn is bad for your mental health, and leave it at that.
It's more complicated than that.
It's about how those beliefs are woven into their understanding of themselves and the world.
Right. For some people, believing in Jinn might bring comfort and strength, while for others, it might increase their distress.
So it all comes down to the individual.
and their specific experiences.
And that's where collaboration between mental health professionals and religious counselors becomes even more important.
They can help the patient explore their beliefs, address any harmful interpretations.
And find ways to reinterpret those beliefs in a way that promotes healing.
It's about finding a balance between respecting the patient's faith and addressing any aspects of that faith that might be contributing to their suffering.
It's a delicate process, but it's so important.
It is.
And I think to really understand this, we need to look at some real-life examples.
Great idea.
Let's delve into some case studies, see how these different approaches have played out in real-world scenarios.
And learn from those experiences.
Sounds good to me. Let's take a quick break, and then we'll jump into those case studies when we come back. Okay, so we're back and ready to dive into these case studies.
All right, let's do it.
I always find real-life stories so helpful.
Me too.
It's one thing to talk about concepts, but seeing how things actually play out.
It brings it all to life.
Exactly.
The paper we've been discussing has a whole section dedicated to this.
Oh, really?
Yeah, 47 case studies where Jinn are mentioned as a possible factor in mental health.
Wow, 47.
It's a pretty significant number.
It is. And what kinds of diagnoses are we talking about?
All sorts: schizophrenia, mood disorders, epilepsy, even OCD.
So it really does cut across the whole spectrum.
It shows you that it's not limited to one specific condition or diagnosis.
Right. It's more about how someone's beliefs and their cultural background can influence their whole experience of mental health.
And how we approach treatment.
Exactly. We can't just dismiss these beliefs as irrelevant.
Absolutely not.
Because for some people, it's a core part of who they are, how they see the world.
And if we ignore that, if we try to force them into a purely biomedical model,
It's not going to work.
it might even make things worse.
They might feel like they're not being heard, like their experiences aren't valid.
And that can erode trust, make them less likely to seek help in the future.
So let's talk about some of these cases.
Okay, which one do you want to start with?
Well, you mentioned a case where combining Islamic and biomedical practices led to a positive outcome.
Oh, yeah, the young man with schizophrenia.
That one.
He was having severe hallucinations.
Both auditory and visual.
He was convinced Jinn were tormenting him, and his family believed it too.
That must have been so frightening for everyone involved.
It was a really tough situation.
So how do they approach treatment?
They started with standard biomedical treatment, antipsychotic medication.
Okay, so that's the Western medicine side.
Right, but then they also brought in a traditional Islamic healer.
With the family's consent, of course.
Of course, it was important for everyone to be on board.
And what did the healer do?
Well, he performed ruqa, reciting verses from the Quran,
Okay, that makes sense.
but he also used some physical methods,
Physical methods.
like hitting the feet with a stick.
Whoa, hold on. Hitting the feet with a stick.
It might sound strange to us,
It does.
but it's a traditional practice in some cultures.
I guess it's important to remember that different traditions have different approaches.
Exactly, as long as it's done with consent and respect.
So what happened? Did it work?
The young man showed remarkable improvement.
Wow, really?
His symptoms subsided, the hallucinations lessened, and he was able to function much better.
That's amazing.
It is, but we can't say for sure what caused the improvement.
Right, it could have been the medication, the ruqyah, the physical methods, or the combination of everything.
Exactly, but the point is the integrated approach seemed to work.
It addressed both the spiritual and psychological aspects of his experience.
And it respected his beliefs.
Which is so important.
It's not about saying one approach is right and the other is wrong.
It's about finding what works for the individual.
Absolutely.
Okay, that's a great example of a positive outcome.
And not all cases are like that.
Right, you mentioned another case, the woman who thought she was pregnant by a jinn.
Oh, that one was heartbreaking.
It sounds like it.
She was convinced she was carrying a Jinn's child.
And you can imagine the stigma, the fear.
She must have felt so isolated.
Absolutely, and in that case, how did they approach treatment?
They used a combination of antipsychotic medication and therapy.
So, more of a biomedical approach.
Right, but the therapy was really important.
Because it gave her a safe space to talk about her beliefs.
Without being judged or dismissed.
And that's so crucial, especially when someone's dealing with something as sensitive as this.
It's about creating a space where they feel heard and understood.
So in that case, it wasn't about incorporating the belief into the treatment directly.
Right.
It was more about addressing the psychological distress that the belief was causing.
And helping her cope with the stigma and fear.
It's fascinating how different approaches can be effective in different situations.
It all comes back to individual needs.
And that's why this whole idea of building bridges between Western medicine and Islamic traditions is so important.
We need to move away from this either thinking.
It's not about choosing one over the other.
It's about finding ways to work together
To create a system of care that's truly holistic and respectful.
and that empowers individuals to make choices that align with their beliefs and values.
I think that's a perfect way to wrap up our deep dive.
It's been an amazing conversation.
We've explored some really complex issues.
But hopefully we've shed some light on the importance of understanding the intersection of Jinn beliefs and mental health.
And how we can all work together to create a more compassionate and effective system of care.
I think so.
Thanks for joining us on this journey, everyone.
Thanks for having me.
It's been a pleasure, and we'll see you next time for another deep dive.